All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the discussion today we are going to do is about a study that is published by New York State, and the study shows that vaccine Pfizer-BionTech vaccine's efficacy in case of children 5 to 11 years of age drops down to 12% from 58, 60% or more to 12% within 28 to 34 days of the vaccination of or of the full vaccination. That is a miserable efficacy. And why is that? Let's look at number one, the data, and number two, look at what their conjectures are. But there is another interesting thing in this study. They say that it seems like, so of course their conclusion, what do you think their conclusion will be? Their conclusion will be take more vaccine, have more dose. But there is another thing that they said, and that was it seems like with the vaccine, multi-layered protection is needed, for example, distancing and masking. That, in my opinion, is an admittance to say, or admission, not admittance, admission to say this is not working. So let's look at the data. So this is the study here, February 28, 2020, 2022 actually. Effectiveness of the BioNTech vaccine among children 5 to 11 and 12 to 17 years in New York after emergence of the Omicron variant. That is a basic study. I'm going to go over the data first, and then we'll look at some of my comments, and we would also look at some of their conclusions. So continuing with our gifts, this is the New York State data that is coming in. So if you see here, New York State Department of Health, Albany, New York, and University at Albany School of Public Health. So this particular paper, it is actually a data analysis, and it is about the Omicron and the vaccine's effectiveness against the Omicron in children 5 to 11 years of age and 12 to 17 years of age. 12 to 17 years of age performed a little better compared to 5 to 11. For 5 to 11, it almost looked like it's not efficacious at all. So vaccine that they looked at was Pfizer-BioNTech. They looked at the data for two type of groups. Those children that were vaccinated previously, months ago, for example, 51 days median duration for the vaccination for 5 to 11 years old, and 211 days median day for 12 to 17. So decent previous time. That could mean vaccine efficacy has declined in general. But they also then compared or observed the data after new vaccination. And last week of December, they had the data for the children that got vaccinated in last week of December, and they saw that within 28 to 34 days of full vaccination, the effectiveness dropped to 12%. So let's look at that data now. So Pfizer-BioNTech, 5 to 11 years of age, they looked at two types of data, cases and hospitalizations. Neither did they tell us about the comorbidities, which I think is a very important aspect for children. Just like for adults as well, higher age. For children, it is important to understand the comorbidities because these children are more at risk. But anyways, that data is not here. Also, the death data is not here. So you cannot really see maybe all of them who ended up in the hospital, they recovered and went back home. So what is the outcome? God forbid, was there any deaths, or were there any sequelae, or was there long COVID? That data is very, very important instead of looking at the cases. Anyways, so let's see. December 13th to January 30th. December 13th, so previous month, December's middle, that was mostly converting to Omicron. It was coming out of Delta. January was Omicron. This 48 days, in this 48 days window, they saw the vaccine efficacy in 5 to 11 years olds for cases go down from 68 to 12%. Then they also have very interesting data here. On a between January 24 to 30, that week, January 24 to 30, in that week, they looked at data once more for the children to see what is the effectiveness for them at this during this week. 11 years old had 11% efficacy. Yes, the age and the efficacy is similar. 11 years old had 11% efficacy. But there is another thing that they don't say it at all in this study, that the confidence interval is -3 to 23. We know that when the confidence interval crosses the unity, the data becomes insignificant. We also know that we say usually that p-value has to be 0.05 or 95% chances of recurrence. And if it is not there, then we have a problem. Here, they don't mention it. They just write it. If I can very quickly show it to you, they would not say anywhere that data is significant or not. So here, sorry, I've marked it so much. Um, Vaccine efficacy. Look at this one. I've actually marked it green instead of red. So, vaccine effectiveness for children 11 years was 11%. 95% confidence interval is -3% to 23%. So, it actually crosses unity. So, basically, they should have said no effectiveness. Although, even if we say that the unity was not crossed, even then, 11%, 12 years of age children during this week, their efficacy, vaccine's effectiveness was 65%, and the 95% confidence interval is 62 to 71. So that is decent. Although 62% is really at the border of being effective as we started off with. So the question is, are they going to look at the side effects and then say, well, here is the effectiveness, and what is the worst case in this case versus the side effects, and then come back and say, you know what, we should do the vaccination or not, or only those children with the comorbidities, or be aware that there can be long COVID, and so the vaccines injuries are this way and the long COVID is this much. So that data analysis would have been great. That's not there. Their reasoning that why 11 years have 11% and 12 years have 65%, their reasoning is it is the vaccine dose. They're saying that this younger ages have 10 microgram per milliliter dose compared to 30 or similar. I think it is something like that. So I'll show it to you from here. If I look at the dose, yeah. So here, compared to children 12, 17 years who received 30 microgram dose, less is known about the real world vaccine effectiveness. And I think that the 5 to 11 had 10 microgram, it says over here. Children 5 to 11 years who received 10 microgram doses. So their thinking is that this drastic difference between these two is possibly because of the vaccine dose. So one of the conclusions they have is to say, for the younger children, also give a higher dose. Okay, so I want to continue. Hospitalization, 5 to 11 years old. I went over the document and separated the 5 to 11 from 12 to 17 so we can see in one package each data. So, hospitalization, 5 to 11. In the beginning, once again, as we were seeing those dates, December to January, 100% effectiveness. And then in January, effectiveness dropped to 48%. So even hospitalization effectiveness has drastically dropped. Although, if this is someone who is at risk, then we should consider that should we give the vaccine or not. The problem is, if the vaccine's total effectiveness window is 1 month, that is even lesser than monoclonal antibodies protection window. AstraZeneca's Evishield monoclonal antibodies, they claim, can continue to protect a person till 6 months or more. The problem with the monoclonals are they still effective against Omicron or not? So, barring that, monoclonals perform better than 1 month long effectiveness for a vaccine. So, anyways, it drops down from 100% to 48%. And look at the 95% confidence interval, minus 12% to 75%. So guess what does that mean? I'm so upset about this study that I cannot speak correctly. Guess what does this mean? Minus 12% to 75% once again crosses the unity. So let me show it to you. Here. Compared to cases, protection was higher for hospitalization by January 24 with IRR 1.9. And look at the vaccine effectiveness here. 48, confidence interval minus 12% to 75% for 5 to 11. They write it, they don't actually make any conclusion on top of it. And you know there should be a conclusion to say not working. So here, hospitalization data, can we really use it when the interval is not correct? Newly fully vaccinated. So that was the vaccinated, previously vaccinated. So maybe vaccinated 51 days, median time was 51 days. So this is vaccinated now, by now, last week of December. And they said, okay, fully vaccinated, new vaccination. So we know that antibodies are there and we know that they are running around. And let's see what does the vaccine do against Omicron in these children. And look at this. By 28 to 34 days after the full vaccination. So dose 1, dose 2, 2 weeks after, then 28 to 34 days. Within a month. Vaccine efficacy for cases goes from 65 to 12. That is the new vaccination. So you could argue that, hey, older vaccination, the antibodies have waned. So we should look at the new vaccination. Not even 1 month. And what would happen after a month? If it has gone down to 12%, how about 30, 40 days, 50 days, 60 days? What will happen then? We'll go back to children and say, I want to vaccinate you once more every month. Although I think they're going to come back and say, we'll give higher doses and that would help with this. So that is, I think, what they're going to do. So let's see higher doses, 12 to 17 years of age, higher doses. How did they do here? So I missed mentioning that this group, 365,502, so this is a significant group size. Similarly, for 12 to 17, the group size is 852,384. They say these are about 20 to 25% of all the children. So here, cases, December 13th to January 30th, same 48 days. Cases, effectiveness was 66%. 66% was the beginning effectiveness. And it went down to 51%. So not a huge drop as we saw with children for 5 to 11 years of age. And they think that this is because they got 30 microgram 2 doses versus children got 10 microgram 2 doses. Children meaning 5 to 11. But still, this has actually gone below the threshold point that FDA and CDC had set for the vaccine's effectiveness. They had said a vaccine should be above 62, 63% for being accepted. Here we have 51%. Hospitalization went down. So this is good. The severe case or hospitalization, 85% was the beginning effectiveness. And it went down to 73% within 1 month. We're just talking 1 month. What happened second month? So what will happen in February and March and April? And the 95% confidence interval range is 53 to 87. Again, it's on the correct side. And the median days for the vaccine was 211. So you can then say, well, how about these children in this age, newly vaccinated? How do they look there? So here is what they saw. Newly fully vaccinated, 76% the beginning, 2 weeks after the, meaning whatever is the definition of full vaccination, 2 weeks after the second dose, to 56% within a month. That is the efficacy. And guess what is really missing here? I could have looked at all of this and still said, you know what? It seems fair to look at the vaccines as good protection if I had the data for comorbidities and the data for death. Again, God forbid for any child to die. And then there is a third part, and that is long COVID. How can our healthcare authorities not reach that conclusion to be able to say in these data analysis that here is the population's vaccination status, here are the comorbidities, this is the vaccination done, these are the cases, these are the hospitalizations, and these are the deaths, and here is the long COVID outcomes, here are the vaccine injury outcomes. And if they can be really kind to us, they can actually do a cost benefit analysis as well to say vaccine and injury, COVID and long COVID, and let's compare them. No, that data is not there. And considering that CDC was not publishing some data, I don't know if this data is actually just not there or data is not actually presented. So then, this is my comment part. So far, the data that I showed was their data. I did put my comments in the middle of this all, but to consolidate my comments in one place, comorbidity data is critical. After 2 years of pandemic, our healthcare authorities should at least understand that now, unless someone from a journalist community has to go and figure out why is that data not shown. Comorbidity is needed. One, death data, as sad and unfortunate in children as it is needed. What if they're not, other than the children with comorbidities, what if healthy children are not affected this way? And I know that people are going to send me studies to say, here is the death data. These studies, these data analysis should contain this. Why do they stop at hospitalization? Then this is very, very interesting. I want to read this out to you. To me, this seems like they are agreeing. So if I go to mask, look at this. This is their statement. Even rapid loss of protection against infections, the results highlight the continued importance of layered protections, including mask wearing for children to prevent infection and transmission. So, to make this statement, they should also actually tell us that if there is infection, what is the outcome of that? So that we can see that do they need to be protected from infection, or how badly they need to be protected from infection, and which group. One. Number two, Transmission, they're still hung up on transmission. We have figured out, I think, by now that those who wanted to get the vaccine have gotten vaccine, majority of them. Some have medical conditions, some have religious exemptions, some just do not want to have the vaccine. There are some who are not taking the vaccine. So people have made their choices. They're still evolving and thinking and changing. We are still hung up on transmission. The masks are actually being removed now. We are saying, okay, fine, no need for masks. The basic statements, what is hidden in this statement for me is vaccine is not working, please wear masks. The question I would say is, okay, fine, vaccine is not working. Are the kids equally badly at risk if the infection is occurring? So that comparative data attached to this is not there. And if I present to you that with the vaccine approval briefings, they go out of their way to even extrapolate data from other cohorts to put them in here to say we need to approve this, so we just pulled the data from the other place because we don't have it. And here where this data can be very useful for parents to make a decision, that data is missing. I guess we should still be grateful that at least this data is given. But this was very interesting for me. Given rapid loss of protection, rapid loss within 1 month, protection gone. Given rapid loss of protection against infection, these results highlight the continued importance of layered protections, including mask wearing for children to prevent infection and transmission. So, does that mean that all of us are not going to wear masks anymore, as CDC and others are uh, uh, making the mask wearing mandates or advice loose or flexible? The children would have to continue to wear masks. Why can't we say, why can't we say this? Here is the side effects. Here are the COVID cases, long COVID cases, deaths. Here is the cost benefit analysis. And we think that the vaccine, because of Omicron, is not working. The companies should go back and fix the vaccine. Then they should come back, and those would be good vaccines for the children. Do you know that that is also not happening? Did you see? I have actually shared that in the past. Let me see if I can find my. Did you see that both Moderna and Pfizer had said that Omicron variant vaccine, Moderna, delayed? So I had shared it before. Remember, they said it will be ready in March, then they said it would go on till August because we are still collecting clinical data. So, August. And both of the companies said a similar statement, gave a similar statement that we are collecting clinical data. The vaccines will be made for Omicron by August. So, if they were really that keen on helping, they had made previous vaccine and boasted about it to say, we made them in 2 weeks. What happened now? I think it's just simply they would not earn that much from these vaccines. So they want to say just use the current ones. So this is the data. So this is it. We're done. If you want to hang on for a little more, I want to show you the table that if you're a parent who want to understand, uh, barring that there is no data for deaths or long COVID or vaccine injury in here, but still they have a decent table. This table might be interesting. So if you see here, this is 5 to 11 years, December 13 to 19 events. These are cases. So vaccinated, unvaccinated, rates per 100,000 vaccinated, unvaccinated, their ratio, their confidence interval, and effectiveness. That all is here. So if you are, for example, curious to say, well, I have a child in 5 to 11 years of age. what was their case rate. So if you see 5 to 11 years of age, let's look at January 24 to 30. Here, vaccinated 162 cases per 100,000 in vaccinated children, 70 cases per 100,000 in unvaccinated children. The ratio, incidence rate ratio, that is, you divide each other's, these two numbers ratios with each other. Remember, this is per 100,000, so this is a ratio. This is also per 100,000, so that is also a ratio. If you divide them once more, that is a ratio of the ratios, and that is called the incidence rate ratio. That is 1.1. So really not much difference. So here the vaccine efficacy is 12%. Same age group in December 13 to 19, where I believe Delta was more and Omicron was less, 68%. And they make one statement, which I think they did not clarify in their document, and that is Delta, they compared it in the beginning, there was Delta, and then that sounded very holy statement. So Delta and then Omicron. It actually is possible that the initial good efficacy was because it was against Delta, and the later bad efficacy or low efficacy is because it is against Omicron, and vaccines are not really doing very well in children against Omicron. You're seeing that in general, vaccines are not offering great effectiveness to children. That doesn't mean that children who are at risk or children who want to be protected, there still is a possibility of severe cases. I just do not know the death data, long COVID data. So, anyways, 12%. If I go for 12 to 17 years, their beginning, so this 85% is Delta. But later, January 24, 51%, that is Omicron. So for Omicron, their efficacy for cases is actually gone below the acceptable range. Hospitalizations, in my opinion, better than the cases is to look at the hospitalization. So 5 to 11 years hospitalization, if you see here, December 13 to 19 week. Once again, this is the per 100,000 0, and unvaccinated per 100,000 0.22. And that could also be that the cohort size for vaccination is small. And so this is 100% effective. Then by the time of January 24 to 30, the vaccinated per 100,000 children 0.31 versus 0.60, and that brings us to a IRR of 1.9 and the efficacy of 48%. 12 to 17 years of age, and these are the number, you can see them here as well, starting from 94% and going down to 73%. And this is really December to January. What would happen in February? What would happen in March? Are we going to ask the children to just keep having the boosters? That would be not the best. So this is the discussion. Please do me a favor, look at this data, look at that table. There are multiple other things in there. For example, they have discussed their limitations, they have discussed what may be the reason for various falls in the declines in the effectiveness, and they have the recommendation, as you saw. um, do more vaccination, number one. Number two, do higher dose vaccination. And number three, have masks as well, so children don't get infected or don't transmit. That is what they say. So this is where we are at. Now, please do me a favor. I hope you like these lectures. So if you like these lectures, then there is a link in the description that has such a low price for Dr. Bean's premium content, 1,000 lectures. And the price, you would look at that, it's not even 2 meals price. And it's not offered to others. So please don't tell anyone other than this link. So if you would like to take advantage of that, please use that. In addition to that, there are links if you would like to buy me a coffee or become a patron or use PayPal. So thank you very much. I have a family dinner today. So I would beg leave for chit chat just for today. I hope that is okay. And I would see you tomorrow. Please stay safe, happy, and healthy. Please give this paper a look as well. It is interesting to look at this data.